Welcome to Concept in Medicine. Today we are going to be looking at sickle cell disease versus sickle cell anemia. The question is sickle cell disease the same as sickle cell anemia? Don't go anywhere, wait, and let's check whether they are the same or not. Let's begin by talking about sickle cell disease. When we say sickle cell disease, it refers to an inherited autosomal recessive hemoglobinopathy characterized by the presence of two abnormal HB alleles, of which at least one is an abnormal sickle hemoglobin allele, that is HBS. Based on the types of allele present, we can classify sickle cell disease as homozygous and heterozygous based on the alleles. So for the homozygous alleles, there is going to be the presence of two abnormal sickle hemoglobin alleles. That will be HBSS. And remember, HBSS is severe with presentation. Then for the heterozygous, it means for that there is going to be one abnormal HBS allele, that's a sickle hemoglobin allele, plus another abnormal HB allele, which could be any. And with that, the examples would be HBSC, which is having a mild presentation, HBS beta null thalassemia, which if care is not taken can progress to severe disease. Then we can also talk about HBS beta plus tau, which is also a mild form. Then HBSD mild, HBSE also mild, then HBSO also mild. HBSD, E and HBSO, they are not so common as compared to the rest. But out of all of them, HBSS is the most common and the most severe. Let's have a look at the sickle cell anemia. So based on that, we can categorically say that sickle cell anemia is a form of sickle cell disease characterized by the presence of two abnormal sickle hemoglobin alleles. That will be HBSS. And with that, we can say that sickle cell anemia is the severe form of sickle cell disease. I believe now it is clear whether they are the same or not. So in short, sickle cell anemia is a form of sickle cell disease. That means that sickle cell disease is the broader umbrella under which sickle cell anemia can be found. To add to that, sickle cell disease can be diagnosed using a test we call HB electrophoresis, and this test is usually advised to be done after the age of 6 months because it is at that age that majority of the fetal hemoglobin will diminish, giving dominance to the adult hemoglobin. And in that case, bear in mind that sickle cell disease, the single point mutation, only occurs in the beta globin chain, which can only be found in the adult hemoglobin, that is HbA1. And it is only after the age of 6 months that HbA1 becomes the dominant hemoglobin in circulation. And it is only that time that the diagnosis of sickle cell disease can be made with the help of HB electrophoresis. I believe we've learned something new today. Thank you very much for staying through this lesson, and kindly make sure to subscribe, like, share, and don't forget to put on your notification bell. My name is Dr. Del, and once again, this is Concept in Medicine. Bye-bye.